Hey, this is JT, and in this video, I'm going to show you guys a recent trip I took to ProMotion, which is a sports chiropractic physical therapy office. And I went in because I was having some tendonitis or some forearm pain, and even up into the bicep a little bit. And resting and scaling back wasn't making it better. So I didn't want it to progress, and I also didn't want to have to compromise my training. So I went in and they performed Graston treatment, which is a soft tissue mobilization technique. And from my understanding, as you train, sometimes what happens is you can get fibrous tissue that starts to develop, like scar tissue, and this is a technique to break that up and mobilize it to get you back to full range of motion and less pain. I'm always very skeptical, and when I was younger, I used to think all that kind of stuff was, voodoo, witch doctor. I only believed in Western medicine. And as I've gotten older and maybe a little wiser, I'm a lot more open-minded. What exposed me to this type of treatment first was my daughter, the gymnast, was having some intense forearm pain about a year ago before her competition season, to the point where she was having to, going into season, scale back on her training, skip specific events, and we thought there was a very real possibility she would have to sit out the season. So we took her to her ortho, who's had to do a dislocation surgery on her in the past. And they did a x-ray, high definition x-ray, and they said, hey, there's nothing wrong with her from our perspective, so I'm gonna refer you to physical therapists, and you can go talk to them. So when we did that, they identified that she needed Graston treatment, and so, which is what you'll see in this video. So they did that to her first, and she went from intense pain, limited range of motion, and having to scale back her training within 24 hours to going 100% in training, not having to scale back at all, and no pain. So I first saw it, seeing is believing with her, and so this time around, almost a year later, when I was starting to have pain in a similar area, I thought, okay, I think I know what this is, I'm gonna go see. And then it turns out that's exactly what it was, and they treated it the same way. If you've seen videos of like Michael Phelps or these athletes where they get cups placed on the muscles, and then they apply pressure to pull the layers of muscle apart, to allow them to work on the range of motion. This is in a similar vein. So this is a similar kind of treatment to cupping, which is more common. Most people are familiar, or more people are familiar with cupping. So when you see this video, it's really uncomfortable, it's really painful, you're gonna see me suffering. But what I did is I traded a few minutes of fairly intense pain for an immediate increase in range of motion and reduction in pain thereafter. So going in, my range of motion was about here, and that's about as high as I could reach my left arm before I had some fairly intense pain, and if I pushed it any further, it was very painful. And immediately after coming out, which you'll see in the video, I got full range of motion back in both arms. And so if you're having pain, tendonitis, anywhere, it might pay dividends to go in and see a professional, and a therapist or chiropractor that does this type of treatment, that specializes in this type of athletic treatment. And then, like I said, in one session, and one painful session, to be honest with you, but in one session, you might have range of motion restored, you might have mobility restored, you might have that chronic pain reduced or eliminated. So this is Graston treatment. You're gonna watch me suffer, and this is what it looks like 2 days later. And in the video, you're gonna see it when it's fresh. So hopefully this helps somebody else out there that's dealing with some chronic pain, get it knocked out and get you back to training. No, just cupped.
So what cupping does is it separates layers of muscle. What this does is this breaks apart scar tissue. To build muscle, you're creating tiny tears. The tiny tears creates a lot of tiny scar tissue, but scar tissue will create more scar tissue. And so what this does is it breaks it apart. It has specific beveled edges on it that are designed to break it apart. It takes about 1,400 pounds of pressure to break apart scar tissue. So you're not doing that with basic massages, even with deep tissue massages. You gotta get aggressive with it.
Oh man, that bicep lit up so fast. So fast.
It was really painful.
This was like 2 goes.
I told you would. That's all I said. This is on one visit fit. Just don't line them up the worst.
I know, it was literally just like 1, 2, it was done.
That is so painful.
I was like feathering.
I told you.
Being a bad patient.
The forearm's not so bad, but the bicep is brutal.
That
Wait
was...
till she does the sub squat.
Can we just do that one like next time?
That'll be an easy fix. The forearms, we're gonna have you come back for. You may have to work on those a few times. You let those get bad.
You get wrist pain?
No, actually, just
Lack of strength?
it's just the forearms really that are a little bit. I what do you want me to do now?
Is that your arm like relaxed?
That's relaxed. Yeah.
Oh my goodness. Okay.
This is uncomfortable. Not gonna lie.
Maybe a little bit worse.
Yeah, this is one of the worst spots to scrape.
Ah, jeez.
Mom is not gonna go near you.
But it hurts really bad and tickles at the same time.
Just laugh through the pain. That's what we do.
Oh, that's brutal. Okay, stop resting. How many minutes are we talking about on this one?
2.
You're already a minute in.
All right, if you get this done, this is brutal.
Yeah.
How's Aiden doing?
You got it? Okay, that was super painful, but I already have better mobility. This doesn't hurt anymore, so I can get back to training.